Welcome to The Pulse, conversations with noted experts in healthcare. Today's guest is Sasha Kalcheff-Korn, and now, here is your host, Maria Zampetoulas.
Hello, everyone. My name is Maria Zampetoulas. I'm a Senior Research Associate for the Power of the Patient Project, the National Library of Patient Rights and Advocacy, a volunteer-led and run organization that celebrates the patient and seeks to empower the patient through education and advocacy. Welcome to our interview series. Today we have as our guest Ms. Sasha Kalcheff-Korn, the Executive Director of the Realm of Caring Foundation, which was established in 2013 and serves those in need of more information about cannabinoid therapies. The Realm of Caring Foundation provides revolutionary CBD and cannabis research, innovative education, and life-changing grants. They seek to facilitate and encourage mainstream acceptance of transformative plant-based therapies to benefit individuals and families, as well as serve healthcare providers, hemp and cannabis industries. Ms. Sasha Kalcheff-Korn brings a wealth of experience in human rights, education, and advocacy, and has led the Realm of Caring Foundation through a very victorious period. Just to give our audience some facts about the accomplishments of the foundation, the Realm of Caring Foundation has assisted over 73,000 clients worldwide to date, receiving one-to-one support, has aided 22 states in passing cannabis legislation, and has over 5,000 plus participants in the observational research registry, which we're going to talk more about. So thank you so much, Ms. Kalcheff-Korn, in taking the time to meet with us and sharing a little bit about the wonderful work that you're doing at this foundation. So to start, I have our first question for our audience members. For those who may not be familiar, can you share a little bit about how the Realm of Caring Foundation began and the kinds of services it provides?
Of course, and thank you for that very beautiful introduction. Very sweet. Yeah, so we were started by two moms over a decade ago. So we were formally established in 2013, but it was 2011, 2012, where two moms had met while their kiddos were receiving palliative care and hospice. Both kids were suffering from different catastrophic forms of epilepsy and had tried all of the pharmaceuticals, all of the different therapies, and were essentially out of medical options. And so both were simultaneously looking into cannabis, specifically high CBD strains, as that next step. Both went forward and tried it and found it actually was a solution for their kids. And then so speaking with these different epilepsy groups and on Facebook, they wanted to help other families do the same who were interested in understanding how they came about this. So they formally established Realm of Caring, and originally was helping families move out to Colorado because this was pre-Farm Bill, so CBD was not federally legal. Medicinal cannabis was not allowed in many states. So they helped these families to move out. And then they wanted to help these families be able to return back home. So they went to work in passing legislation from state to state and opened our free hotline, which you mentioned is servicing those over 73,000 clients globally to date. So it is a free hotline. They just wanted families, individuals, industry partners, medical professionals to be able to come to a one-stop shop and find quality, research-backed, up-to-date education that's free. And then they also went on to, which I know we'll talk about a little bit later, but the observational research registry. So started funding research around 2016. So that way they could really legitimize this as a form of therapy. So to date, we still have our independent research. We still service the hotline. We help enroll patients into the registry and consumers into the registry. And then this is our way to also try and give back. So we can give back for participation in the form of gift cards and discounts, different compensations, because this is it can be a costly therapy because insurance doesn't always cover it. And so we're looking for ways to advocate for that change and make it more accessible for people.
And that's so wonderful. And you're doing such amazing work. I can't imagine the degree of impact it's already have had and is having. I read the stories on the founding members' children, and just so inspiring, so amazing. And I know you feature links on, I believe, the website, right? Where if anyone wants, they can, further read into that those stories and really just be wowed by the therapeutics of cannabis. So thank you. So what led you to joining this mission? You have a very inspiring background yourself, and I've read a little bit about your background. What brought you to the Realm of Caring Foundation? And once joining, what sort of areas have you discovered in patient rights and advocacy that led you to forming new insights or new discoveries that you might not have had before?
Yes. Well, much like yourself, I've always been interested in servicing people and nonprofit work. So I've been in nonprofit work probably for about 12, 13 years. But coming to this job specifically, it starts a little bit back. It starts actually when the foundation sort of was formed. At the time I was an ABA therapist, so I was providing therapy to autistic kiddos. And one of my kids was one of the families who had moved out to Colorado for access. And they were using CBD, and their mom was helping to start as a volunteer to start up Realm of Caring. So I had known about Realm of Caring for a while. And then at the same time, I was earning my master's in human rights. And one of the courses I was taking was on the international and domestic consequences of the drug war. So I had this kind of, very interesting viewpoint on, cannabis as a human rights issue, access as a human rights issue, but then seeing the patient as not just, not only adults, but pediatrics. And so that's where I became, of course, interested in the advocacy work. But it wasn't until 2019 that I actually switched from education, wanting to be back in nonprofit work full time, and a job happened to pop up for Realm of Caring. So it was very serendipitous that I just, saw that and hopped in. And I think that since I've been in this position, so I started in 2019 as a care specialist. I've been in as executive director since 2022. So just over 2 years. But I think since I've been in this position, what I've seen is that we still have a long way to go as far as patient autonomy, as far as looking at this truly as a human rights issue, and that so many people don't have access to something that is reportedly safe and researched to be much safer than several pharmaceuticals out there, and life-saving and life-changing. And or, on the flip side, access is gained and then those rights get stripped away a little bit at a time because there's still a prohibitionist mindset, still a lot of stigmas. And so I would say that's probably the biggest takeaway that I've had in recent years.
And I've seen that as well. You have this war on drugs, and then you have myth and stigma, and then you have the research. And I love that the Realm of Caring Foundation is there to provide that research for the people who may have been swayed by one belief or another, or don't know what's truth and what's myth. And I love that your organization is there to provide factual, empirical evidence for these therapeutics.
Yes,
So
that's the goal.
yeah. So, which leads me to my next question. In 2016, the Realm of Caring Foundation began what is currently the world's largest cannabis registry with the Johns Hopkins University, known as the Observational Research Registry. How has this initiative advanced research in the use of medical marijuana to date, and where can patients access the research findings that have come out of this initiative?
Yes, well, I'll go a little bit backwards. So you can find the research papers that have been published to date. They're on our homepage and also on our research library page on our website. We've published 4 papers based off of this data specifically, and then another paper off of an independent study that we did. So this has been really important because in 2016, the founders recognized that, as I said before, to truly legitimize this as a form of therapy, we needed to understand how people were using and benefiting from cannabis in their everyday lives. And I say cannabis encompassing cannabis, CBD, different cannabinoids, so not just high THC plants. And so what we're doing in this is it's taking a snapshot on how people are using in their everyday lives and using commercially available products, which is, of course, important because if you're looking at a clinical study, that's not necessarily going to be a product that somebody could go and purchase from the store and then use. So that's what we're looking. So we've had over 5,000 participants enrolled, as you mentioned, over the last 8 years, and still growing on that body of data. And so what we've published on so far, we've looked at overall quality of life, anxiety, depression, epilepsy. And one of the unique things that I really find is that we have, our founders are caregivers. And so when they're thinking about questions and they're consulting with the teams who are building the surveys, they're going to ask questions that maybe not every researcher might think of, such as how does it affect the caregiver? What's the caregiver burden score? What are the visits to the ER, doctor's appointments, or missed days of work? So looking at these different measures, but then also taking a lot of qualitative data, allowing the participant to really fill in the box on how they're feeling, how this might be benefiting them, where are they seeing the downfalls in the system. And so the last paper that we published on was our qualitative paper. So it really looked at our qualitative data. And I loved that because it showed us as Realm of Caring that we're here for the right reasons, we're in the right place, because there's still a lot of confusion with consumers as far as education. How do I find a quality product? What does the research say? So there's still a lot of confusion there for the end consumer, the end user. And so it helps us to reaffirm that we're in the right place at the right time.
Yes. And I know you mentioned that there are 4 published articles. Within those 4, is there a specific population in terms of age that was looked at, or is it, strictly adults for now, or are kids?
It's everybody. So and then for under 18, for minors, the survey was filled out by their caregiver. So and that was a great way, actually, because we are looking at controls. So we're also looking at non-users. The study's open to anybody, users, non-users, initiators. So it was great. It was a great model with the caregiver being able to fill it out for their child, because then the caregiver, if they weren't using cannabis, could also fill it out and serve as a control. And so it's a way even for the caregiver to give back to the research community and build a body of data.
Which is great. That's so wonderful. So leading me to my follow-up question. In 2018, the Realm of Caring, you have an education initiative, which expanded to medical professionals through the practitioner portal. With the medical use of cannabis having now expanded to 38 states, how has the legalization of cannabis impacted this initiative, and how has the foundation sought to educate providers across various specializations?
Yeah, so this is such an interesting thing because it's really, the cannabis industry is very unique in that the consumer has far outpaced the scientific and medical communities. So the consumers experimenting, purchasing, using before it's even involved in the medical degree program that doctors, nurses, et cetera, should have knowledge on the endocannabinoid system and how cannabinoid therapy may benefit. And even as we're passing recreational use state to state, we're seeing still that there might be a shift towards, okay, well, if it's recreational, we don't need a medical program. And so then you start to see the medical programs kind of go away, and there's not really enough of the medical professional community to potentially advocate for these patients who could benefit, because in medical dispensaries, you have access to higher percentages of different cannabinoids. You have lower costs because of lessened taxes. So there are a lot of benefits to having the medical system in place from state to state. So even though recreational use and that, the legalization that's kind of blooming over a little bit at a time, it's beneficial for everybody all around. There's still a lot that needs to be done as far as education. Yeah. We need to make sure also that when we're thinking about education, it does need to reach our policymakers at the top. We still need to transfer the scientific knowledge to policy change. And so when you have, our legislatures from different states listening to their constituents, they might have combating ideas of, what it means to be a medicinal cannabis user. And so really to get that education to them, so they're understanding how their constituents are benefiting, how this is a medically useful tool for individuals to have. I hope that answered your question, but there's still
it does, yes. Yeah. And I think it did answer my question. I know there's a lot around, like you said, the current expansion of recreational use, of medicinal use, and first and foremost, it's important that our legislators are aware of the medicinal therapeutic value of these therapies. But then, like you said, even when there is recreational use, that there's still a need for the medical environment to still be present, to sort of inform the use, or how people might think it should be used versus some myths they might have, bought into. So there's a lot of education that still remains. And yes, it definitely answered my question. I guess as a follow-up to that question, are there webinars that are provided by the Realm of Caring Foundation to communities? How often does that take place? Is it once a year? Is it twice a year? Is it dependent upon, the need or the demand?
Yes, which is, I think, what I missed out in that second part of like, how do we?
That's okay, no worries.
How do we get that education?
It was a convoluted question.
Yeah. So we have our weekly blogs. And so those are educational blogs, which we send out to our healthcare practitioner community and then our general community, which can be based on, if it's an awareness month, it's our cancer prevention month. So what benefits could cannabinoids potentially have? So we are talking about medical topics, but then just providing what research is out there and what it says. Our webinars are typically scheduled monthly, where again, we're just talking about we're sort of taking the highest number of questions that we're getting from our clients, because we know that if they're asking us these questions, that they're probably also wanting to ask their doctors these questions.
Right.
So when we gear a webinar towards the healthcare practitioner community, we're letting them know these are questions that are coming in from our clients, and this is how we would answer them. So that way we can inform them and sort of like fill in that gap where a patient might be a little bit afraid to bring it up to their doctor. So we try to empower them to bring the questions. And a doctor might not necessarily want to outright ask a patient if they're using or planning to use cannabis.
Right.
Yeah.
And we're on the same wavelength. We're totally on the same wavelength, because I was just about to ask you my next question. How would you recommend patients approach this topic with their providers if they're either uncomfortable or they don't know how? What are the best first steps to take in addressing this exploration, of cannabis use as a treatment in their healthcare?
Yes, and we understand this can be an incredibly touchy subject, and also just kind of not knowing in state to state, should I have a medical card if I'm a caregiver for my child who's taking CBD? In many states, the answer to that question is yes, but it's not broadly known. So when we are able to have these conversations with individuals before they go to the doctor, then we can at least equip them with the research-backed information, so that way they feel confident in what they're saying to their doctor, because it can be a very intimidating situation as well if you don't have good rapport. And also just making sure that you're set up, that you have your med card if needed, that you're using a quality product, that you understand where your product is from, that you understand how it could benefit you. And so kind of just coming along with like a checkbox of like,
Yes.
okay, these are the questions that my doctor could ask me. Let me go through with them with my realm of care and care specialist, if I can give us a plug, because that's one of the biggest things that we do. And then going through with the care specialist on how do I ask these questions and what answers could I give my doctor, so that way I can work that way into a conversation. Because it's really important to have these discussions with your practitioner as well, just because there's a lot of potential drug-to-drug interactions or drug-to-herb interactions. And so there's just, a lot of things you want your doctor to be aware of, because they could be starting you on a medicine. You might be too scared to bring up the fact that you're taking CBD, and they could have conflicting outcomes in your body. So.
And now there is, from what I remember when I went on your website, there is a hotline that patients, anyone of interest, can call. And is it specific to people who are only using any of the products, or people who may want to have some not counseling per se, but some advice on how to approach these consulting?
Yeah, anybody could call. I mean, and it could be for your pet, your grandmother, your son. It
Oh,
could
for
be
pets, I didn't know that. That's awesome.
Yeah, for pets also. Yeah. And so, and it could be, you could be a medical professional yourself. You could be an industry professional, a bud tender, and you just want to know how you could safely offer advice to a customer that steps to your counter. We've gotten it all. And so, yeah, open to anybody who just wants more information. So novice or experienced user, sometimes you get an experienced user who just says, I've been taking this for so many years and it's not doing it for me anymore.
Yeah.
What do I do now? Yeah.
Now I'm thinking of my sister's Frenchie Yogi, who has all of this energy, and he's taking essential oils now, somewhat helping, but you might get a call from us about Yogi at some point. He's a sweet bundle of joy, but definitely could benefit from a more calmer disposition.
Yeah.
And for my last question, in 2023, the Realm of Caring Foundation began collaborating on a research project supported by a National Institute of Health grant, which was awarded to Johns Hopkins University Behavioral Pharmacology Research Unit to expand research on medicinal cannabis and health outcomes. So my question is, what are the foundation's short and long-term goals with the use of this grant, and how will this impact the foundation's services?
Yeah, absolutely. Yeah, so this was a really exciting project.
Congratulations, by the way.
Thank you. Yes, thank you very, very much. Yeah, it's kind of unheard of to see a nonprofit just linked up with the university in this capacity to do such a large job, really. I mean, because it will be 5 years. The goal for this is to enroll 10,000 participants over the next 5 years. And so, and these are going to be individuals not currently using cannabis, but they intend to. So you have that clear baseline reading, and then they'll receive surveys over the course of the following year. So the true reason for this is so that way we can start in a more formal capacity. So we had this research registry with Hopkins for 8 years, right? So you could almost imagine this is like the next version. It's elevated. There's more resources. Has backing by the federal government. And the intention is to make this truly a collaborative project where other institutions could donate their data, and it just growing. So then anybody could access the data and use it for to understand findings, because really this is just to understand health outcomes on how individuals are using and potentially benefiting from commercially available products. And so not just medicinal patients, but also it's medicinal use, but you don't have to have a medical card. You could be buying recreationally. You could be growing yourself. It's not very stringent. It's just you're intending to use cannabis, you start using cannabis, and then what are the outcomes of that? But it's really great to have this recognition from NIDA and NIH that they want to look into this, and they do find that this is important work, because we've been beating that drum for so many years, and now that there's a broader recognition, it's really very rewarding.
Yeah, very amazing to now have the support behind something that, you know, you've been shining a light on for so long, and now here it is to provide, you know, solid research on it.
Yeah,
I can
absolutely.
imagine just the outcomes of that are going to be tremendous, and what it allows the organization to expand into, and for patients as well, and families.
Yes. Yeah. And just to speak to that, I mean, it allows us as Realm of Caring to really fulfill our biggest mission, which is just to help more people. So this gets more people potentially calling Realm of Caring, saying, I would like guidance on my therapy, because the ultimate goal is, of course, access, affordability, but then also ensuring that people are using responsibly in a way
Right.
that's right for them in their diagnosis. It's not a one size fits all, and that's always
Right.
something you want to get out there too. Yeah.
And that's wonderful that you'll be there along every step of the way, which is great. It's not just you're there in the beginning, you're really there throughout, and informing people, educating them.
Yes. Yeah.
Thank you so very much. That concludes our time, our interview. Thank you so much again for taking the time to speak with us and to, you know, shine a light on this very important mission and the work that you're doing on behalf of patients, but, you know, more than patients, individuals everywhere, families. I hope this provides some really valuable resources and information for those who may not have been aware of this foundation before, and the wonderful work you're all doing, and helps people make more informed decisions and empowers them on their healthcare journey. Really to know that they have options, and if something hasn't worked, that there is an alternate path, and that the Realm of Caring is there to provide education, resources, and advocacy where it's needed. So thank you so very much again. And I look forward to following the Realm of Caring Foundation and learning more about the wonderful work you're all doing.
Thank you so much, Maria. It's my pleasure.
Thank you.